Welcome to Sydney Fibroid Clinic's overview of treatment options for uterine fibroids. If you have recently been told you have fibroids, or if you have been living with symptoms for months or even years, it can be overwhelming trying to understand what your options are. You may have heard about tablets, hormone therapy, the Mirena IUD, endometrial ablation, myomectomy, hysterectomy, or uterine fibroid embolization. Each option works differently, and not every treatment is suitable for every woman. In this video, we'll walk through the main treatment options, explain what each one can and cannot do, and help you understand why a personalized treatment plan is so important. Let's get started. First off, what are fibroids? Fibroids are benign growths of the uterus. Some women have one fibroid, others have several. Some fibroids are small and cause no symptoms at all, while others grow large enough to cause heavy menstrual bleeding, pelvic pain, pressure, bloating, frequent urination, or discomfort during sex. Treatment choice depends on several factors: the severity of symptoms, the size and location of fibroids, your age, and whether you are planning future pregnancy. In this video, we will cover medical treatments, including combined oral contraceptive pills, progesterone-only pills, Ryco, and the Mirena IUD. Procedural treatments, including endometrial ablation and hysteroscopic resection. Surgical treatments, including myomectomy and hysterectomy. And finally, we will explain uterine fibroid embolization, also called uterine artery embolization or UFE/UAE, a minimally invasive alternative supported by randomized trial evidence. Our aim is to give you clear, evidence-based information to help you understand your options. Not all fibroid treatments are equal. Here's what you need to know. Tranexamic acid may be used to reduce heavy menstrual bleeding. However, it does not shrink fibroids, nor does it control their growth. It works only on the symptom of bleeding, not on the underlying cause. This means it may help manage bleeding for a period of time, but it does not treat the underlying fibroid itself. For women with larger fibroids, multiple fibroids, or symptoms caused by pressure, tranexamic acid is unlikely to be a complete long-term solution. Combined oral contraceptive pills and progesterone-only pills are commonly used to manage heavy bleeding and regulate cycles. However, it is important to understand their limitations. The pill does not shrink fibroids, it does not remove fibroids, and it does not stop the underlying growth of fibroids. As fibroids enlarge, symptoms can return or worsen. Heavy bleeding may come back. Pressure symptoms may increase. Pain or bloating may become more noticeable. For this reason, oral hormone therapy may be useful for symptom control in selected patients, but it may not be enough when fibroids are large, growing, or significantly affecting quality of life. Ryco is a newer combination hormone therapy used for moderate to severe symptoms of uterine fibroids. It works by stopping your body from producing its own sex hormones and replacing them with carefully balanced doses of estrogen and progesterone. For some women, Ryco can be effective in reducing heavy bleeding and improving fibroid-related symptoms. However, Ryco is still a medical therapy. It does not remove fibroids. Clinical studies have shown that while it can reduce bleeding, its effect on fibroid shrinkage may be limited compared with procedures that directly target the fibroid blood supply. In the information provided by Sydney Fibroid Clinic, clinical studies show Ryco achieves approximately 12% fibroid shrinkage at 6 months, while uterine fibroid embolization achieves an average of approximately 60% shrinkage in the same time frame. Like all medications, Ryco can have side effects. Some patients may experience hot flushes, headaches, mood changes, or irregular bleeding. This is why Ryco should be prescribed and monitored by a doctor who understands the patient's full medical history, symptoms, age, and risk factors. It may be a suitable option for some women, especially those looking for symptom control without a procedure, but it is not the right answer for everyone. The Mirena IUD releases progesterone locally inside the uterus. Its main effect is to thin the uterine lining, which can reduce menstrual bleeding. For women whose main symptom is heavy menstrual bleeding and whose uterine cavity is not significantly distorted, Mirena IUD may help reduce bleeding. However, Mirena IUD does not shrink fibroids. It does not stop fibroids from growing, and it does not treat pressure symptoms caused by larger fibroids. There is also an important issue with fibroid location. Possible side effects can include irregular bleeding or spotting, pelvic pain, breast tenderness, acne, mood changes, and weight changes. Endometrial ablation is a procedure that uses heat energy to destroy the lining of the uterus. The goal is to reduce menstrual flow. For ablation to work properly, the device needs to make even contact with the uterine lining. This is important because the treatment depends on applying heat evenly across the inner surface. If fibroids distort the uterine cavity, that even contact may not be possible. Some areas may be treated, while others may be missed. This can lead to incomplete treatment and ongoing symptoms. It is also important to understand that endometrial ablation only treats the lining of the uterus. It does not shrink fibroids. It does not remove fibroids. And it does not treat fibroids within the muscle wall or outside the uterine cavity. For some women, it may reduce bleeding, but in women with significant fibroids, especially those distorting the cavity, it may not be effective. Hysteroscopic resection is a procedure where a camera and specialized surgical instrument are inserted through the cervix to remove fibroids from inside the uterine cavity. Because the procedure is performed through the cervix, there are no abdominal cuts. However, this treatment is only suitable for certain types of fibroids. For a complete resection, the fibroid usually needs to be small enough and positioned mostly inside the uterine cavity. In the criteria provided by Sydney Fibroid Clinic, the fibroid should be under 4 centimetres and at least 50% inside the cavity. This is where the iceberg effect becomes important. A fibroid may appear to be inside the cavity, but a large portion may actually extend deep into the muscle wall of the uterus. The part inside the cavity may be removed, while the deeper portion remains. Fibroids within the muscle wall, or fibroids located elsewhere in the uterus, are left behind and may continue to grow. This means symptoms can return over time, especially if multiple fibroids are present. Myomectomy is the surgical removal of individual fibroids while preserving the uterus. For women who wish to keep their uterus, or who are planning future pregnancy, myomectomy may be considered. However, it is still major surgery. Fibroids are often deeply embedded within the muscle wall of the uterus and can have a strong blood supply. This makes myomectomy technically challenging and can increase the risk of bleeding during surgery. There are different types of myomectomy. An open myomectomy involves a larger abdominal incision and may require a recovery period of around 4 to 6 weeks. A laparoscopic myomectomy uses smaller incisions, but it is considered one of the more technically challenging gynecological procedures. It requires a highly specialized surgeon, particularly when fibroids are large, multiple, or located in difficult areas. Another limitation is recurrence. Myomectomy removes selected fibroids, but it may not remove every fibroid, especially very small fibroids or microscopic beginnings of new fibroids. Remaining fibroids may continue to grow. New fibroids may develop. This can lead to a return of symptoms, and in some cases, the need for further treatment or repeat surgery. Hysterectomy is the surgical removal of the uterus. Because the uterus is removed, hysterectomy permanently stops periods and removes the possibility of fibroids returning in the uterus. For some women, it may be an appropriate choice, especially when symptoms are severe, other treatments are unsuitable, and there is no desire for future pregnancy. However, hysterectomy is major surgery, and it comes with important risks and long-term considerations. Surgical risks can include infection, bleeding, complications from anesthesia, and possible injury to nearby organs such as the bladder, bowel, or ureter. Recovery can also be significant, particularly after an open hysterectomy, where recovery may take around 6 weeks. There are also longer-term considerations. Some patients may face increased risks of pelvic organ prolapse, urinary incontinence, and sexual dysfunction. Research has also linked hysterectomy with an increased risk of cardiovascular disease in some patient groups. This does not mean hysterectomy is always the wrong choice. For some women, it may be the right treatment, but it should be chosen after a careful discussion of all available options, the benefits, the risks, and the long-term implications. Uterine fibroid embolization, also called UFE or uterine artery embolization, is a minimally invasive treatment for fibroids. Instead of surgically removing the fibroids, UFE works by blocking the blood supply that feeds them. Fibroids depend on blood flow to survive and grow. During UFE, an interventional radiologist guides a tiny catheter into the arteries supplying the uterus and releases small particles to reduce blood flow to the fibroids. Over time, the fibroids shrink, soften, and become less active. As they shrink, symptoms such as heavy bleeding, pressure, pain, and bloating may improve. UFE is usually performed under local anaesthetic with no large surgical incision. Compared with open surgery, recovery is typically much shorter. In many cases, patients stay in hospital overnight and return to normal activities within about 1 week, compared with several weeks of recovery after open surgery. One of the key advantages of UFE is that it treats the whole uterus at once. Unlike myomectomy, which removes selected fibroids, UFE targets the blood supply to all fibroids at the same time. This includes fibroids that are visible on scans and smaller fibroids that may not yet be causing symptoms. This is why UFE may reduce the chance of symptoms returning due to untreated fibroids. UFE also preserves the uterus, which is important for many women who want to avoid hysterectomy. Randomized controlled trial evidence has shown that UFE can provide significant symptom relief for women with fibroids, and it is recognized as an important minimally invasive alternative to hysterectomy for suitable patients. When it comes to fibroids, there is no single best treatment for every woman. The right option depends on the full picture. How heavy is the bleeding? Is there pain or pressure? How large are the fibroids? Are they inside the cavity, within the muscle wall, or growing outward? Is the uterus enlarged? Are there future pregnancy plans? Has treatment already been tried before? A medication may be enough for one patient. Another patient may need a procedure, another may benefit from UFE. And in some cases, surgery may still be appropriate. What matters most is that each woman understands her options clearly before making a decision. That includes the benefits, the risks, the recovery time, the chance of recurrence, and the long-term outcomes of each treatment. At Sydney Fibroid Clinic, fibroid treatment is tailored to each woman's needs. The clinic considers symptoms, fibroid size and location, medical history, lifestyle, and personal preferences before recommending a treatment plan. Sydney Fibroid Clinic specialises in uterine fibroid embolization as a minimally invasive alternative to hysterectomy, and may also combine medical treatments, UFE, and adjunct minimally invasive procedures to help women avoid major surgery where appropriate. If you have fibroids and want to understand your options, speak with a specialist experienced in the full range of fibroid treatments. A detailed consultation can help you understand what is causing your symptoms, what treatments are suitable for you, and which pathway may offer the best outcome.